So right now, as you're listening to this, millions of bullets are flying through low Earth orbit at 17,000 miles per hour. Except they're not actually bullets. Maybe it's a bolt that fell off of a satellite in 1998. Maybe it's a fleck of paint the size of your fingernail. Or maybe it's an entire dead satellite the size of a school bus. Whatever it is, at those speeds, even a paint chip hits like a hand grenade. Astronauts could tell you all about this firsthand. They've heard the sharp ping of fragments striking the exterior of the International Space Station. They've even had to take shelter in emergency capsules during close calls with fast-moving fragments. These fragments, these bolts, these paint chips, scientists and astronauts, they call it space debris. I call it what it is, an infection waiting to spread. Every fragment, no matter how small, is part of an invisible web of space debris circling our planet. And what's happening above our heads, it isn't random chaos. It's the early stages of an epidemic in space. And if space debris keeps multiplying, we risk a chain reaction of collisions that can make parts of orbit unusable for centuries. So why should we care what's happening hundreds of miles above our head? Because space isn't just up there anymore. It's everywhere down here. This morning, you probably checked your phone before you got out of bed. GPS told you how long your commute would be. Weather satellites told you whether or not you should bring an umbrella. Maybe you also opened your laptop and communication satellites connected you with servers on the other side of the planet in milliseconds. Each one of these moments depends on the health of satellites quietly doing their jobs just beyond the edge of our atmosphere. Space isn't some abstract frontier anymore. Space is the invisible infrastructure of modern civilization, and we're more connected to it than we realize, and more dependent on it than we admit. And while we rely on space more than ever, we're also filling it faster than ever. We're in the middle of a new space race, one worth more than $1 trillion, with rocket launches every few days, sometimes carrying hundreds of satellites at once. The same technology connecting rural villages to high-speed internet is also turning low Earth orbit into an increasingly crowded highway. And what happens when highways get crowded? Accidents. In February 2009, an active communications satellite, Iridium, so one people were actually using, collided with Cosmos, a dead Russian satellite, at 26,000 miles per hour. The crash instantly created over 2,000 trackable fragments, and thousands more too small for our radar to see. More than a decade later, the majority of these fragments are still in orbit today. Here, you can see the aftermath unfold, from mere hours after the impact to a full year later. It was the first orbital collision between two satellites, and it showed just how quickly space debris can scatter and spread through orbit and turn into a global orbital hazard. And now, pieces of space debris are starting to fall back towards Earth. So just a few weeks ago, a Delta passenger jet may have been struck by fallen space debris. So let me say that again. A commercial aircraft full of passengers potentially hit by something that fell from the edge of space. Around that same time, a large chunk of charred metal was found in the Australian outback. And this wasn't the first time that this was found in Australia. They've been finding space debris for years. This isn't science fiction. This is reality. What happens in orbit doesn't stay in orbit, and what we can't see can still hurt us. As part of my doctoral research at Johns Hopkins, I was reading about the Kessler syndrome, this nightmare hypothetical scenario where collisions in orbit produce fragments, and those fragments then get involved in collisions and produce more fragments until parts of orbit become so dense with space debris that we can't use them anymore. And so I'm looking at this conceptual illustration of Kessler syndrome, which shows one satellite colliding with a space debris object, creating, say, 3 new space debris objects, and each of those 3 new objects colliding with another object and creating 3 more new objects. And something clicks that I've seen this before, not in space, but in epidemiology. So now imagine a virus spreading through a population. One person infects 3 new individuals, and those 3 new individuals infect 3 more and 3 more. An exponential chain reaction. This is exactly what happens with a collision in orbit. Think of Iridium and Cosmos. 2 satellites collide and produce fragments. Those fragments can then collide and produce more fragments, and so on. Infectious diseases and space debris aren't words you typically hear in the same sentence, but both involve exponential growth and chain reactions. So as part of my doctoral research and through working at the Johns Hopkins University Applied Physics Lab, I created a model, which I call JAM, the Junk Accumulation Model, to describe this behavior. And so what my model does is help us to see and understand the spread and proliferation of space debris as something we already know how to fight, an outbreak. So my model is based on the classic SIR model that epidemiologists have been using for over a century to track the spread of diseases. And they do this by looking at the movement between compartments. So in epidemiology, we're talking about susceptible humans susceptible to infections and diseases. So if a susceptible human comes in contact with someone who is infected, and they themselves become infected, they move to the infectious compartment, where they would stay before they hopefully recover from the disease and move to the recovered compartment. Now in orbit, rather than susceptible humans, we would be talking about susceptible satellites, so ones susceptible to collisions. So if a satellite is involved in a collision and it creates fragments, that satellite and the new fragments would move to the infectious compartment, not infectious humans anymore, infectious space debris, where they would stay until they're removed from the system via, say, burning up in the atmosphere. The same equations, the same dynamics, and the same exponential curves. JAM doesn't just describe the problem, it allows us to experiment with solutions. By adjusting parameters like launch rate and collision rate, we can test what-if scenarios. So what if we double the launch rate? Or what if we cut it in half? What if we removed a certain number or percentage of space debris each year? JAM shows how just small changes in behavior can prevent a cascade of collisions or trigger one. The only difference between an SIR model and my JAM model is with JAM, the epidemic, the outbreak, it isn't biological, it's orbital. And that's when I realized I wasn't just modeling space debris. I was uncovering the beginnings of what I now call space epidemiology, the study of how infections spread through orbit rather than through people. And just like epidemics, just like outbreaks among humans, orbital outbreaks are also preventable, but only if we act early. So we've seen this pattern before on Earth. We've learned lessons from COVID-19, right? We learned that once an outbreak is obvious, it means we've already lost. Once hospital beds are full, the outbreak has been spreading exponentially for weeks. We learned that we need global coordination because viruses don't respect borders. And we learned that we need data-driven intervention, mass vaccines and contact tracing. All of these things have the power to slow or even stop exponential growth if we act early enough. So all of these lessons can be applied to space debris. In public health, we vaccinate the most vulnerable first. In orbit, we can do the same. Space agencies are already developing active debris removal concepts, or ADR, and you can think of it like an orbital cleanup crew. Engineers are demonstrating ways to remove space debris, things like nets that wrap around fragments or entire satellites. And so you can think of these like vaccines. You target the most dangerous object, maybe the largest object, or the ones in the most crowded orbits, and you remove them before they can infect anything else. In public health, we also have contact tracing. We map who infected whom, so we see where the virus might spread and we try to get ahead of it. In orbit, we can do the same. We track space debris. We know where the fragments and satellites, we know what orbits they're in, and so we can maybe predict where a collision might happen. Prevention costs far less than cleanup. It's easier to vaccinate an entire population than to treat millions of sick people in the ICU. It's easier to remove one dead, dangerous object than to replace thousands of satellites later on. We already know how to stop exponential growth and chain reactions. We just need to apply that wisdom above our heads. We need to look up. And space feels infinite when you look up at the night sky. But space isn't limitless, and it's not self-cleaning. It's a shared resource, a global commons, like the air and like the ocean. And every shared space, whether it's on Earth or above it, depends on shared responsibility. You might not be able to remove space debris yourself, but you still have gravity in this story. So what can you do? You can scrutinize, you can speak, and you can share. So first, scrutinize. Ask mega constellation satellite companies their deorbit plans, because public pressure matters. Second, you can speak and let policymakers know that you care about space sustainability, not just about cool innovations. And third, you can share and talk about this idea, because Epidemics taught us that awareness saves lives, and awareness can also save space. And once awareness spreads, that's when responsibility follows. Once people understand that space isn't infinite, that orbits can collapse, and that we're already seeing the early signs of cascade failure, that's when policy changes, and that's when we solve this. If we act now, we can keep our orbital highways open. We keep humanity's gateway to space accessible. But if we don't, we're looking at a cosmic traffic jam that could lock us out of our own orbit for generations. Every epidemic is fueled by behavior. This epidemic in orbit is no different. And in this epidemic in orbit, this epidemic of space debris, we're both the host and the cure. The infection started with us, the debris is ours, but the solution is ours too. It's not too late to rewrite the space debris prognosis. Human ingenuity made space an asset for our species. Human ingenuity created a $1 trillion economy up there. And human ingenuity connected the entire planet through satellites. Human negligence could turn it into our biggest mistake.